Question 1. During the evaluation of proposed amendments to the Health Insurance Portability and Accountability Act, HIPAA privacy rules, a healthcare reform specialist is tasked with ensuring that reforms adequately address stigma and discrimination related to mental illness. Which of the following actions would best align with the principles of comprehensive healthcare reform and regulatory compliance in this context? Option A. Recommending the inclusion of explicit provisions that prohibit health insurers from using mental health diagnoses to deny coverage or charge higher premiums, and advocating for enhanced mental health parity requirements in all insurance plans. Option B. Focusing solely on strengthening HIPAA existing provisions for the privacy of all health information, assuming that general privacy protections will inherently mitigate mental health stigma. Option C. Proposing that individuals seeking mental health treatment be required to undergo additional screening and verification processes to ensure the legitimacy of their conditions, citing concerns about potential misuse of mental health services. Option D. Suggesting that the reform efforts prioritize addressing disparities in chronic physical diseases, as these are perceived to have a more direct and measurable impact on public health outcomes. The correct answer is A. Recommending the inclusion of explicit provisions that prohibit health insurers from using mental health diagnoses to deny coverage or charge higher premiums, and advocating for enhanced mental health parity requirements in all insurance plans. Explanation. This scenario is professionally challenging because it requires navigating the delicate balance between patient privacy, the legal obligations of healthcare providers, and the pervasive societal stigma surrounding mental illness. A healthcare reform specialist must ensure that reforms actively combat discrimination and promote equitable access to care, which includes addressing the impact of stigma on individuals seeking mental health services. Careful judgment is required to implement policies that protect vulnerable populations while upholding the principles of healthcare reform. The correct approach involves advocating for and implementing policies that explicitly prohibit discrimination based on mental health conditions and promote mental health parity. This aligns with the core principles of healthcare reform, which aim to ensure access to comprehensive care for all individuals, regardless of their health status. Specifically, this approach would involve reviewing and recommending amendments to existing regulations or proposing new ones that strengthen protections against discrimination in insurance coverage, employment, and access to healthcare services. It also entails promoting public awareness campaigns and educational initiatives to reduce stigma. This approach is ethically and regulatorily justified by the overarching goals of healthcare reform to achieve universal access and eliminate health disparities, which inherently include mental health. An incorrect approach would be to focus solely on physical health disparities while neglecting the unique challenges faced by individuals with mental illness. This fails to acknowledge that mental health conditions are a significant component of overall health and that reforms must be comprehensive. Such an approach would be a regulatory failure because it would not fulfill the mandate of healthcare reform to address all aspects of health and well-being, potentially leaving a significant portion of the population underserved and subject to ongoing discrimination. Another incorrect approach would be to assume that existing general anti-discrimination laws are sufficient to address the specific nuances of mental health stigma. General laws provide a baseline. They often lack the specificity needed to tackle the deeply ingrained biases and systemic barriers that individuals with mental illness encounter in the healthcare system. This approach represents an ethical failure by not proactively seeking to dismantle specific barriers to care, and a regulatory failure by not ensuring that healthcare reforms are tailored to address the unique needs of all patient populations. A third incorrect approach would be to prioritize cost containment measures for mental health services without adequately considering the impact on access and quality of care for individuals with mental illness. While fiscal responsibility is important, it should not come at the expense of equitable access or the effectiveness of treatment. This approach would be a regulatory failure, as it could lead to discriminatory practices by limiting coverage or availability of necessary mental health services, thereby undermining the goals of healthcare reform. The professional decision-making process for similar situations should involve a thorough understanding of the specific regulatory framework governing healthcare reform in the relevant jurisdiction. This includes identifying existing laws and guidelines related to patient rights, non-discrimination, and mental health parity. Professionals should actively engage with stakeholders, including patient advocacy groups and mental health professionals, to gather insights into the lived experiences of individuals affected by stigma and discrimination. The process should prioritize evidence-based strategies for reducing stigma and promoting equitable access to care, and it should involve a continuous evaluation of the effectiveness of implemented policies and a willingness to adapt and improve them based on outcomes and feedback. Question 2. The control framework reveals a critical juncture in implementing a new population health management strategy that relies heavily on advanced data analytics. The organization has access to a vast repository of patient data, including electronic health records, claims data, and social determinants of health information. The primary objective is to identify high-risk patient cohorts for targeted preventative care interventions. However, the organization is grappling with how to ethically and legally operationalize this analytics initiative while ensuring the privacy and security of protected health information, FI, as mandated by U.S. federal regulations. Which of the following approaches best navigates this implementation challenge? Option A. Proceed with direct analysis of identifiable patient data to quickly identify high-risk cohorts, relying solely on existing IT security measures to protect PHI, and assuming that the public health benefit outweighs minor privacy concerns. Option B. Limit data analytics to publicly available, aggregated datasets that do not contain any PHI, even if this significantly reduces the ability to identify specific high-risk patient groups for targeted interventions. Option C. Prioritize the de-identification and aggregation of patient data for broad analytical purposes, implementing strict access controls and audit trails for any necessary use of identifiable PHI, and ensuring compliance with HIPAA privacy and security rules. Option D. Focus exclusively on developing sophisticated predictive algorithms without first establishing clear data governance policies or de-identification protocols, assuming that the technical sophistication of the algorithms will inherently protect patient privacy. The correct answer is C. Prioritize the de-identification and aggregation of patient data for broad analytical purposes, implementing strict access controls and audit trails for any necessary use of identifiable PHI, and ensuring compliance with HIPAA privacy and security rules. Explanation. The control framework reveals a common implementation challenge in leveraging data analytics for population health initiatives within the U.S. healthcare system. The professional challenge lies in balancing the immense potential of data analytics to identify health trends, predict outbreaks, and personalize interventions with the stringent privacy and security regulations governing protected health information, FI. Specifically, the Health Insurance Portability and Accountability Act, HIPAA, imposes strict rules on the use and disclosure of PHI, requiring robust safeguards to prevent unauthorized access or breaches. Organizations must navigate these complexities to ensure compliance while maximizing the utility of their data. The correct approach involves establishing a comprehensive data governance framework that prioritizes de-identification and aggregation of data wherever possible, coupled with strict access controls and audit trails for any use of identifiable PHI. This aligns with HIPAA privacy rule, which permits the use of de-identified data for research and public health purposes without individual authorization, and its security rule, which mandates technical, physical, and administrative safeguards. By focusing on de-identified data and implementing robust security measures for any necessary use of identifiable data, organizations can ethically and legally harness the power of analytics to improve population health outcomes. An incorrect approach would be to proceed with broad data analysis, using identifiable PHI, without first implementing rigorous de-identification protocols, or obtaining appropriate patient consents and authorizations where required by HIPAA. This directly violates HIPAA privacy rule, which limits the use and disclosure of PHI to specific purposes and requires patient authorization for many uses beyond treatment, payment, and healthcare operations. Another incorrect approach is to solely rely on technical security measures without addressing the underlying data governance and ethical considerations, such as ensuring data accuracy and avoiding algorithmic bias that could disproportionately impact certain populations. This overlooks the ethical imperative to ensure that data analytics benefits all segments of the population equitably and does not perpetuate existing health disparities. A further incorrect approach is to limit data analytics to only readily available, aggregated datasets that may lack the granularity needed to identify specific population health needs, thereby hindering the effectiveness of interventions and failing to fully realize the potential of data-driven health reform. Professional decision-making in such scenarios requires a multifaceted approach. First, thoroughly understand the specific data analytics goals and the types of data required. Second, consult relevant legal and compliance experts to ensure adherence to all applicable regulations, particularly HIPAA. Third, prioritize data de-identification and aggregation techniques. Fourth, implement robust security protocols and access controls for any use of identifiable PHI. Finally, continuously monitor and evaluate the effectiveness and ethical implications of data analytics initiatives to ensure they are contributing to equitable improvements in population health. Question 3. Operational review demonstrates that a large healthcare system is facing pressure to improve its financial margins. The leadership is considering several strategic initiatives, which approach best aligns with the core principles and regulatory requirements of healthcare reform, specifically concerning population health and community well-being. Option A. Invest heavily in cutting-edge medical technologies that have shown promise in other markets, regardless of specific community needs. Option B. Initiate a comprehensive community health assessment to identify key health needs, disparities, and social determinants of health within the service area, and use these findings to inform strategic planning and resource allocation. Option C. Streamline internal administrative workflows to reduce operational overhead and improve efficiency. Option D. Focus exclusively on optimizing billing and coding processes to maximize revenue capture from existing patient services. The correct answer is B. Initiate a comprehensive community health assessment to identify key health needs, disparities, and social determinants of health within the service area, and use these findings to inform strategic planning and resource allocation. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a healthcare reform specialist to balance the immediate operational needs of a healthcare organization with the long-term strategic imperative of community health improvement, as mandated by regulatory frameworks. The pressure to demonstrate immediate financial viability can often overshadow the foundational importance of understanding and addressing community health needs, which are critical for sustainable reform. Careful judgment is required to integrate these seemingly disparate objectives. Correct approach analysis. The correct approach involves prioritizing the development and utilization of a comprehensive community health assessment, CHA, as the cornerstone for strategic planning and resource allocation. This is justified by the regulatory framework for healthcare reform, which emphasizes population health and requires organizations to understand the health needs of the communities they serve. A CHA provides the data and insights necessary to identify disparities, prioritize interventions, and align organizational goals with public health objectives, ultimately leading to more effective and equitable health care reform. This approach directly addresses the core purpose of health care reform, improving the health of populations. Incorrect approach is analysis. Focusing solely on immediate financial performance metrics without a foundational CHA fails to meet regulatory requirements for population health management and can lead to misallocation of resources. This approach neglects the underlying health issues that contribute to higher costs and poorer outcomes, thus undermining the long-term goals of healthcare reform. Prioritizing the implementation of new technologies without first understanding the community's specific needs and readiness for adoption is a misapplication of resources. While technology can be a tool for reform, its effectiveness is contingent on addressing the actual health challenges identified through a CHA. Without this assessment, technology adoption may be inefficient or irrelevant to the most pressing community health concerns. Concentrating efforts on internal process improvements without external community health context risks creating an organization that is efficient in serving an assumed population, but not necessarily the actual community it is intended to serve. This inward focus can lead to a disconnect between the organization's services and the real-world health needs of the community, hindering meaningful health reform. Professional reasoning. Healthcare reform specialists must adopt a proactive and data-driven approach. The decision-making process should begin with a thorough understanding of the regulatory mandate to improve community health. This necessitates initiating or leveraging existing comprehensive community health assessments. The insights gained from the CHA should then directly inform strategic planning, resource allocation, and the prioritization of initiatives, whether they involve technology, internal processes, or financial management. This ensures that all organizational efforts are aligned with the overarching goal of improving population health outcomes and achieving sustainable health care reform. Question 4. Comparative studies suggest that effective health care reform strategies are deeply rooted in the principles of public health and its overarching goals. Considering the U.S. regulatory framework for health care, which of the following approaches best aligns with these principles and goals when evaluating proposed reforms? Option A. Prioritizing reforms that demonstrably improve population health outcomes and reduce health disparities, while ensuring compliance with federal and state public health laws and regulations. Option B. Implementing reforms based on emerging trends and technologies without a thorough assessment of their alignment with established public health goals or regulatory requirements. Option C. Focusing primarily on reforms that significantly reduce the overall cost of healthcare delivery, regardless of their impact on population health metrics. Option D. Emphasizing reforms that maximize individual patient choice and autonomy, even if they do not directly address broader public health concerns or systemic inequities. The correct answer is A. Prioritizing reforms that demonstrably improve population health outcomes and reduce health disparities, while ensuring compliance with federal and state public health laws and regulations. Explanation. This scenario is professionally challenging because it requires a specialist to balance competing public health objectives with the practical realities of implementing reforms within a specific regulatory framework. The core challenge lies in prioritizing interventions that yield the greatest population health benefit while remaining compliant with established laws and guidelines. Careful judgment is required to ensure that proposed reforms are not only theoretically sound in public health principles, but also legally permissible and ethically defensible. The correct approach involves a systematic evaluation of proposed health care reforms against the established goals of public health, such as disease prevention, health promotion, and equitable access to care, as defined by the relevant U.S. regulatory framework. This approach prioritizes interventions that demonstrably improve population health outcomes and reduce health disparities, aligning with the overarching mandate of public health. Specifically, it requires understanding how federal and state laws, such as the Public Health Service Act and relevant Affordable Care Act provisions, guide the implementation of such reforms. The ethical justification stems from the principle of beneficence and justice, ensuring that reforms serve the common good and address inequities. An incorrect approach that focuses solely on cost reduction, without a commensurate analysis of health outcomes, fails to uphold the primary goals of public health. This approach risks sacrificing population well-being for financial expediency, potentially violating the principle of beneficence. Another incorrect approach that prioritizes individual patient choice over population-level interventions may overlook critical public health strategies like vaccination programs or community-based disease management, which are essential for collective health and are often mandated or encouraged by public health regulations. This neglects the principle of population health management. An approach that ignores existing regulatory frameworks and proposes reforms without considering their legal feasibility is fundamentally flawed, as it cannot be implemented and therefore cannot achieve any public health goals. This demonstrates a failure in due diligence and professional responsibility. Professionals should employ a decision-making framework that begins with clearly defining the public health problem and its scope. This should be followed by identifying potential interventions and rigorously assessing their alignment with public health principles and goals. Crucially, each potential intervention must be evaluated for its compliance with the applicable U.S. regulatory framework, considering both federal and state laws. Ethical considerations, including equity, autonomy, and beneficence, should be integrated into this assessment. Finally, the chosen approach should be the one that maximizes population health benefits within the legal and ethical constraints. Question 5. Risk assessment procedures indicate that a healthcare system is facing challenges in effectively integrating National Quality Forum, NQF, endorsed performance measures into its daily operations and strategic planning. The organization is seeking to improve patient outcomes and demonstrate adherence to quality standards, Which of the following approaches best addresses the implementation challenge of NQF measures? Option A. Develop a comprehensive implementation plan that includes a gap analysis, stakeholder engagement, phased rollout, and robust data monitoring systems, tailored to the organization's specific context. Option B. Focus solely on upgrading the electronic health record system to capture the required data points for NQF measures, assuming clinical staff will adapt to new workflows. Option C. Mandate the adoption of all NQF measures across all departments simultaneously, without considering departmental variations in workflow or patient populations. Option D. Prioritize immediate cost reduction initiatives, deferring full implementation of NQF measures until financial stability is achieved. The correct answer is A. Develop a comprehensive implementation plan that includes a gap analysis, stakeholder engagement, phased rollout, and robust data monitoring systems, tailored to the organization's specific context. Explanation: this scenario is professionally challenging because it requires a healthcare reform specialist to navigate the complexities of implementing National Quality Forum (NQF) endorsed measures within a healthcare system that may have competing priorities, resource constraints, and varying levels of stakeholder buy-in. The specialist must balance the imperative to improve quality and patient outcomes, as guided by NQF standards, with the practical realities of operationalizing these measures. Careful judgment is required to ensure that the implementation is effective, sustainable, and aligned with both regulatory expectations and the organization's strategic goals. The correct approach involves a systematic and collaborative strategy for NQF measure implementation. This includes conducting a thorough gap analysis to understand current performance against NQF standards, developing a phased implementation plan with clear objectives and timelines, engaging key stakeholders, clinicians, administrators, IT patients, to foster buy-in and address concerns, and establishing robust data collection and reporting mechanisms to monitor progress and demonstrate compliance. This approach is justified by the NQF's own guidance, which emphasizes the importance of a structured and evidence-based approach to quality improvement. Furthermore, regulatory frameworks often mandate the use of standardized quality measures, making adherence to NQF standards a critical component of compliance and a driver for improved patient care. An incorrect approach would be to solely focus on the technical aspects of data collection without engaging clinical staff. This fails to address the human element of quality improvement, potentially leading to resistance, inaccurate data, and a lack of sustained commitment to the measures. Ethically and regulatorily, this approach neglects the importance of clinician involvement in defining and achieving quality goals, which is often a prerequisite for successful implementation and can undermine the validity of the reported quality data. Another incorrect approach would be to prioritize immediate cost savings over the rigorous implementation of NQF measures. While financial sustainability is important, compromising the integrity of quality measurement for short-term financial gains can lead to long-term reputational damage, regulatory penalties, and ultimately, poorer patient outcomes. This approach violates the core principles of quality improvement and the intent behind NQF endorsements, which are designed to drive meaningful improvements in healthcare. A third incorrect approach would be to adopt a one-size-fits-all implementation strategy without considering the unique context of different departments or service lines. NQF measures, while standardized, may require tailored application to be effective across diverse clinical settings. Failing to adapt the implementation plan can lead to inefficiencies, frustration, and a failure to achieve the intended quality improvements. This approach lacks the strategic foresight necessary for successful quality reform and can lead to suboptimal outcomes. Professional decision-making process for similar situations should involve a comprehensive understanding of the NQF framework and its implications for the specific healthcare organization. This includes 1. Assessing the current state of quality measurement and performance. 2. Identifying relevant NQF measures and their alignment with organizational goals. 3. Developing a detailed implementation plan that includes stakeholder engagement, resource allocation, and data management. 4. Establishing mechanisms for ongoing monitoring, evaluation, and refinement. And 5. Ensuring compliance with all applicable regulations and reporting requirements. Question 6. Investigation of a state's public health department's approach to developing a comprehensive response plan for a novel infectious disease outbreak, focusing on how the plan addresses the safeguarding of electronic protected health information, E-FI, in accordance with federal regulations. Which of the following approaches best aligns with the Health Insurance Portability and Accountability Act, HIPAA, security rule and ethical considerations for patient data protection during a public health emergency? Option A. Creating a plan that outlines specific protocols for maintaining the confidentiality, integrity, and availability of ePHI during the emergency, including provisions for secure communication, data backup, and access controls while acknowledging potential resource limitations. Option B. Focusing the response plan exclusively on clinical response and public health interventions, assuming that data security is a secondary concern that can be managed by individual healthcare entities. Option C. Relying on existing, general data security policies and procedures without specific modifications or risk assessments tailored to the unique demands of a public health emergency. Option D. Developing a plan that prioritizes rapid data sharing among healthcare providers and public health agencies, with a commitment to retroactively address data security measures once the immediate crisis subsides. The correct answer is D. Developing a plan that prioritizes rapid data sharing among healthcare providers and public health agencies, with a commitment to retroactively address data security measures once the immediate crisis subsides. Explanation. Scenario analysis. This scenario presents a professional challenge in navigating the complex interplay between federal mandates for public health emergency preparedness and the practical realities of state-level resource allocation and operational capacity. The Health Insurance Portability and Accountability Act, HIPAA security rule, while not directly dictating emergency response plans, establishes the framework for protecting electronic protected health information E-FI, which is critical during any public health crisis. The challenge lies in ensuring that emergency response plans, while robust, do not inadvertently compromise patient privacy or data security, especially when resources are strained. Careful judgment is required to balance the urgency of response with the legal and ethical obligations to safeguard sensitive health information. Correct approach analysis. The correct approach involves developing a comprehensive emergency response plan that explicitly integrates HIPAA security rule requirements for the safeguarding of ePHI during a public health emergency. This approach is right because it acknowledges that the legal and ethical obligations to protect patient data do not cease during a crisis. Federal regulations, such as those under HIPAA, mandate specific security measures to prevent unauthorized access, use, or disclosure of ePHI. A plan that proactively addresses how to maintain these safeguards, even under duress, demonstrates adherence to regulatory frameworks and ethical patient care. This includes provisions for secure communication channels, data backup and recovery, and access controls that remain effective during disruptions. Incorrect approach is analysis, focusing solely on the immediate operational needs of the emergency response, without explicit consideration for HIPAA security rule compliance, represents a significant regulatory and ethical failure. This approach risks unauthorized disclosure or breaches of ePHI, leading to potential legal penalties and erosion of public trust. Prioritizing speed over security in data handling during an emergency is a direct contravention of HIPAA mandate to protect patient information. Another incorrect approach is to assume that existing standard operating procedures for data security are sufficient for a public health emergency without specific adaptation. Emergencies often involve unique circumstances, such as increased remote access, potential system failures, and the need for rapid information sharing, which can create vulnerabilities not addressed by routine security protocols. Failing to conduct a specific risk assessment for emergency scenarios and update protocols accordingly is a regulatory oversight. Finally, deferring all data security considerations to a later date after the immediate emergency has passed is also professionally unacceptable. While the immediate response is paramount, the potential for data breaches and their consequences necessitates ongoing attention to security throughout the emergency period. This approach neglects the continuous nature of data protection obligations. Professional reasoning. Professionals in this field should employ a risk-based decision-making framework. This involves 1. Identifying all applicable federal and state regulations, including HIPAA, relevant to public health emergencies and data security. 2. Conducting a thorough risk assessment that specifically considers the vulnerabilities and challenges posed by various public health emergency scenarios to EPHI. 3. Developing a layered response plan that integrates operational needs with robust data security and privacy safeguards. This includes contingency plans for data access, transmission, and storage under emergency conditions. 4. Establishing clear protocols for staff training on emergency data handling procedures, emphasizing both operational efficiency and security compliance. 5. Implementing mechanisms for ongoing monitoring and adaptation of the plan as the emergency evolves and new information or threats emerge. Question 7. Strategic planning requires a healthcare organization to select the most effective quality improvement methodology to enhance patient safety and operational efficiency. Considering the U.S. regulatory framework for healthcare reform, which emphasizes value-based care and evidence-based practices, how should an organization approach the selection and application of methodologies like Lean and Six Sigma? Option A. Solely implement Six Sigma to rigorously reduce all process variations, assuming that defect reduction is the primary driver of quality improvement and cost savings under healthcare reform. Option B. Conduct a comparative analysis of Lean and Six Sigma, identifying the specific strengths of each and addressing identified quality gaps and aligning their application with regulatory goals for patient outcomes and efficiency. Option C. Prioritize Lean principles to eliminate all identified waste in administrative and clinical processes, believing that efficiency gains will automatically translate to improved patient safety and compliance. Option D. Adopt a methodology based on its popularity within the healthcare industry, without a detailed assessment of its suitability for the organization's specific quality challenges or its alignment with U.S. healthcare reform objectives. The correct answer is B. Conduct a comparative analysis of Lean and Six Sigma, identifying the specific strengths of each and addressing identified quality gaps and aligning their application with regulatory goals for patient outcomes and efficiency. Explanation. This scenario presents a professional challenge in selecting the most appropriate quality improvement methodology for a healthcare organization, aiming to enhance patient outcomes and operational efficiency within the U.S. regulatory framework. The challenge lies in understanding the nuances of different methodologies and aligning their application with the overarching goals of healthcare reform, which emphasize value-based care, patient safety, and cost-effectiveness as mandated by legislation like the Affordable Care Act, ACA, and its subsequent amendments. Careful judgment is required to ensure the chosen methodology not only addresses the identified quality gaps, but also integrates seamlessly with existing compliance requirements and strategic objectives. The correct approach involves a comparative analysis that recognizes the strengths of Lean and Six Sigma in addressing specific types of quality issues. Lean excels at identifying and eliminating waste, streamlining processes, and improving flow, which directly supports efficiency goals and can reduce costs without compromising care. Six Sigma, with its data-driven approach and focus on reducing variation and defects, is highly effective in improving the reliability and predictability of clinical processes, thereby enhancing patient safety and reducing errors. A hybrid approach, often referred to as Lean Six Sigma, can leverage the strengths of both to achieve comprehensive quality improvement. This aligns with the regulatory emphasis on evidence-based practices and continuous improvement to meet performance metrics set by agencies like CMS, which are crucial for reimbursement under value-based purchasing programs. An incorrect approach would be to solely focus on one methodology without considering the specific nature of the quality problem. For instance, exclusively applying Lean principles might overlook the need for rigorous statistical analysis to reduce clinical variation in complex procedures, potentially failing to address patient safety concerns adequately. Conversely, a sole reliance on Six Sigma's defect reduction might overlook opportunities for significant process streamlining and waste elimination that Lean addresses, leading to less efficient resource utilization. Another incorrect approach would be to adopt a methodology without considering its compatibility with the existing organizational culture and the specific regulatory environment. For example, implementing a highly data-intensive Six Sigma project without adequate staff training or buy-in could lead to resistance and failure to achieve desired outcomes, potentially violating ethical obligations to provide competent care and comply with reporting requirements. Professionals should employ a decision-making framework that begins with a thorough assessment of the specific quality improvement goals and the nature of the problem. This involves understanding the current state, identifying root causes, and defining desired outcomes. Subsequently, they should evaluate the suitability of various quality improvement methodologies based on their strengths, weaknesses, and alignment with organizational capacity and regulatory requirements. A comparative analysis, as advocated by the correct approach, allows for an informed selection of the most effective methodology or a combination thereof. This process should also involve stakeholder engagement to ensure buy-in and successful implementation, ultimately supporting the organization's commitment to delivering high-quality, safe, and efficient healthcare services in compliance with U.S. healthcare reform mandates. Question 8. The evaluation methodology shows that a healthcare system implemented a new pay-for-performance (P4P) program aimed at improving chronic disease management. To assess its impact, the system compared the average quality scores of participating providers before and after the program's launch, noting a significant increase. Which of the following evaluation approaches would provide the most robust and ethically defensible assessment of the P4P program's true impact, adhering to U.S. healthcare reform principles? Option A. Conducting a qualitative survey of participating providers to gauge their perceived satisfaction with the P4P program and their subjective experience of improved patient care. Option B. Solely relying on the increase in average quality scores observed among participating providers after the program's implementation, attributing all gains to the P4P initiative. Option C. Focusing the evaluation exclusively on the adoption rates of new clinical protocols by participating providers, without examining patient outcomes or comparing them to a control group. Option D. Comparing the average quality scores of participating providers before and after the program's launch, while also analyzing trends in similar quality metrics for a comparable group of providers not participating in the P4P program, controlling for baseline differences. The correct answer is D. Comparing the average quality scores of participating providers before and after the program's launch, while also analyzing trends in similar quality metrics for a comparable group of providers not participating in the P4P program, controlling for baseline differences. Explanation. The evaluation methodology shows a common challenge in assessing the effectiveness of pay-for-performance (P4P) programs within the U.S. healthcare system. The professional challenge lies in isolating the true impact of the P4P incentives from other confounding factors that influence healthcare quality and cost, such as underlying patient populations, provider practice patterns independent of the incentive, and broader market forces. This requires a robust evaluation design that can credibly attribute observed changes to the P4P program itself. The correct approach involves a quasi-experimental design that attempts to mimic a randomized controlled trial by comparing outcomes for providers or patients exposed to the P4P program with a similar group not exposed, while controlling for baseline differences and secular trends. This could involve methods like difference in differences or propensity score matching. This approach is ethically and regulatorily sound because it aims to provide an unbiased estimate of the program's impact, which is crucial for demonstrating accountability to payers, policymakers, and the public. It aligns with the principles of evidence-based practice and responsible stewardship of healthcare resources, as mandated by various federal and state healthcare reform initiatives that encourage data-driven decision-making and program effectiveness. An incorrect approach would be to solely rely on pre-post analysis without a control group. This fails to account for changes that would have occurred naturally over time or due to other interventions, leading to an overestimation or underestimation of the P4P program's true effect. This is ethically problematic as it can lead to misallocation of resources based on flawed evidence and may not fulfill the regulatory requirement for demonstrating program efficacy. Another incorrect approach is to focus exclusively on process measures without considering outcome measures. While process measures can indicate adherence to best practices, they do not guarantee improved patient health. P4P programs are intended to improve both quality and outcomes. Ignoring outcomes can lead to a distorted view of the program's success and may not align with the overarching goals of healthcare reform, which emphasize patient well-being and value. This can also lead to providers gaming the system by focusing on easily achievable process metrics rather than meaningful improvements in patient care. A third incorrect approach is to attribute all observed improvements in a provider's performance to the P4P program simply because the program was implemented. This ignores the potential influence of other concurrent initiatives, changes in clinical guidelines, or shifts in patient demographics. This simplistic attribution is not scientifically rigorous and can lead to inaccurate conclusions about the P4P program's effectiveness, potentially leading to its inappropriate continuation, modification, or discontinuation. Professionals should employ a systematic and rigorous evaluation framework that prioritizes causal inference. This involves clearly defining the program's objectives, identifying appropriate comparison groups, selecting robust statistical methods to control for confounding variables, and considering both process and outcome measures. Transparency in methodology and reporting of findings, including limitations, is also essential for ethical and regulatory compliance. Question 9. The review process indicates that a company experienced a significant reduction in workforce, leading to several employees losing their group health insurance coverage. To ensure compliance with federal regulations regarding continuation of coverage, which of the following actions best reflects a process optimization strategy for COBRA administration? Option A. Issue a general announcement to all employees about the possibility of COBRA continuation coverage without specifying individual eligibility or providing election forms. Option B. Provide COBRA election forms to affected employees only after they have been unemployed for a period of 30 days to allow them time to consider their options. Option C. Wait for affected employees to inquire about their COBRA rights and then provide them with the necessary information to elect continuation coverage. Option D. Develop and implement a standardized checklist to identify all qualifying events, accurately determine the eligibility of affected individuals, and ensure the timely issuance of both the General Notice of COBRA rights and the COBRA election notice within the legally prescribed timeframes. The correct answer is D. Develop and implement a standardized checklist to identify all qualifying events, accurately determine the eligibility of affected individuals, and ensure the timely issuance of both the General Notice of COBRA rights and the COBRA election notice within the legally prescribed timeframes. Explanation. The review process indicates a common challenge in administering COBRA continuation coverage, ensuring timely and accurate notification to eligible individuals following a qualifying event. This scenario is professionally challenging because missteps can lead to significant financial penalties for the employer and, more importantly, gaps in essential health coverage for employees during critical life transitions. The complexity arises from the interplay of federal regulations, specifically the Consolidated Omnibus Budget Reconciliation Act of 1985, as amended, and the administrative burden of tracking qualifying events and providing proper notice within strict timeframes. The correct approach involves a proactive and systematic process for identifying qualifying events, accurately determining eligibility, and issuing COBRA election notices within the legally mandated periods. This approach prioritizes compliance with the Employee Retirement Income Security Act (ERISA) and the Internal Revenue Code, which govern COBRA. Specifically, employers must provide a general notice of COBRA rights within 90 days of the qualifying event, and an election notice within 14 days of being notified of the qualifying event, or within 44 days of the date coverage is lost, whichever is earlier. This ensures individuals have the information needed to make informed decisions about continuing their coverage. An incorrect approach that focuses solely on responding to employee inquiries about COBRA eligibility after a lapse in coverage fails to meet the regulatory requirement for proactive notification. This oversight constitutes a failure to comply with ERISA notice provisions, potentially exposing the employer to excise taxes and civil penalties. Another incorrect approach, which involves providing incomplete or inaccurate information on the COBRA election notice, also violates regulatory requirements. This can lead to confusion, missed election deadlines, and potential legal challenges. Furthermore, an approach that delays the issuance of election notices beyond the statutory deadlines directly contravenes COBRA purpose of providing uninterrupted coverage and incurs significant penalties. Professionals should adopt a decision-making framework that emphasizes understanding and adhering to the specific timelines and content requirements of COBRA regulations. This involves establishing robust internal procedures for tracking employee status changes, identifying qualifying events, and ensuring timely and accurate distribution of all required COBRA notices. Regular training for HR personnel on COBRA administration and periodic audits of the process are crucial to maintaining compliance and mitigating risks. Question 10. The performance metrics show a concerning upward trend in hospital readmission rates for patients with chronic obstructive pulmonary disease, COPD, within 30 days of discharge, following the rollout of a new telehealth monitoring service designed to improve post-discharge care. As a healthcare reform specialist, which of the following actions is the most appropriate initial response? Option A. Conduct a comprehensive root cause analysis of the increased readmission rates, examining the telehealth service's implementation, patient engagement, and clinical support protocols, while also reviewing relevant patient data and feedback. Option B. Focus on reallocating resources from the telehealth service to traditional in-person follow-up appointments to address the perceived shortcomings. Option C. Attribute the rise in readmissions to patient noncompliance with post-discharge instructions and advise for stricter patient adherence enforcement measures. Option D. Immediately recommend the discontinuation of the telehealth monitoring service due to its apparent negative impact on patient outcomes. Correct answer is D. Immediately recommend the discontinuation of the telehealth monitoring service due to its apparent negative impact on patient outcomes. Explanation. The performance metrics show a significant increase in patient readmission rates for a specific chronic condition following the implementation of a new care coordination program. This scenario is professionally challenging because it pits the intended positive outcomes of a healthcare reform initiative against unintended negative consequences. A healthcare reform specialist must navigate the complexities of policy evaluation, stakeholder management, and ethical considerations to ensure patient well-being and program integrity. The specialist needs to balance the drive for innovation and efficiency with the fundamental responsibility to provide safe and effective care. The correct approach involves a thorough, data-driven investigation into the root causes of the increased readmission rates. This includes analyzing the program's implementation, identifying specific breakdowns in care coordination, and assessing whether the program's design or execution inadvertently created new barriers to care. The specialist must then recommend evidence-based adjustments to the program, prioritizing patient safety and adherence to established healthcare quality standards and regulatory guidelines for patient care and program oversight. This aligns with the ethical imperative to do no harm and the regulatory requirement for healthcare programs to demonstrate effectiveness and patient benefit. An incorrect approach would be to dismiss the data as an anomaly or to blame external factors without a systematic review. This fails to uphold the professional responsibility to critically evaluate program performance and address identified issues. Another incorrect approach would be to immediately recommend the termination of the program without a comprehensive understanding of the contributing factors. This could prematurely discard a potentially valuable initiative and disregard the resources already invested, while also failing to fulfill the obligation to improve patient outcomes. A third incorrect approach would be to focus solely on cost-saving measures without adequately addressing the clinical implications of the increased readmissions, thereby prioritizing financial goals over patient health and safety, which is a direct violation of ethical and regulatory mandates in healthcare. Professionals should employ a structured decision-making process that begins with objective data analysis. This involves forming hypotheses about the causes of the observed outcomes, gathering further qualitative and quantitative data to test these hypotheses, and consulting with relevant stakeholders, including clinical staff and patient representatives. The process should then move to developing and evaluating potential solutions, considering their feasibility, impact on patient care, and alignment with regulatory requirements and ethical principles. Finally, a plan for implementation and ongoing monitoring should be established to ensure sustained improvement. Question 11. Assessment of a community health organization's proposed health promotion and disease prevention strategies for a low-income urban population, considering their alignment with U.S. federal healthcare reform objectives and best practices in public health, requires a nuanced evaluation. Which of the following approaches best reflects a rigorous and compliant assessment? Option A. Prioritizing strategies that are the least expensive to implement, with the assumption that cost savings will inherently lead to improved overall health system efficiency. Option B. assessing the strategies primarily by the number of community members they are expected to reach and the ease of implementation, assuming broad reach equates to effectiveness. Option C, evaluating the strategies based on their documented evidence of effectiveness in similar populations, their cultural appropriateness, and their potential to address social determinants of health, alongside projected impact on health outcomes and healthcare utilization. Option D, reviewing testimonials from program participants and community leaders to gauge satisfaction and perceived benefits without requiring independent validation of health outcomes. The correct answer is C, evaluating the strategies based on their documented evidence of effectiveness in similar populations, their cultural appropriateness, and their potential to address social determinants of health, alongside projected impact on health outcomes and healthcare utilization. Explanation: this scenario presents a professional challenge because a healthcare reform specialist must evaluate the effectiveness of health promotion and disease prevention strategies within the constraints of U.S. federal regulations and established best practices. The specialist needs to move beyond superficial program descriptions to critically assess whether the chosen strategies are evidence-based, culturally competent, and aligned with the goals of improving population health outcomes while managing healthcare costs, as mandated by various U.S. healthcare reform initiatives. Careful judgment is required to distinguish between well-intentioned but potentially ineffective programs and those that demonstrably contribute to public health goals. The correct approach involves a comprehensive evaluation that prioritizes evidence-based interventions and considers the social determinants of health. This aligns with the principles of the Affordable Care Act, ACA, which emphasizes preventive care and population health management. Regulatory frameworks, such as those governing Medicare and Medicaid, increasingly incentivize or require the implementation of programs that demonstrate measurable improvements in health outcomes and reductions in disparities. Ethical considerations also demand that interventions be equitable and accessible to all populations, particularly vulnerable groups. An approach that focuses solely on the number of participants without assessing outcomes fails to meet regulatory expectations for program effectiveness and accountability. It neglects the core purpose of health promotion and disease prevention, which is to achieve tangible health improvements. This approach is ethically problematic, as it may lead to the misallocation of resources towards programs that do not deliver meaningful benefits. An approach that relies on anecdotal evidence or testimonials, while potentially highlighting positive experiences, lacks the rigor required by regulatory bodies and evidence-based practice guidelines. Such an approach cannot reliably demonstrate the effectiveness or cost-effectiveness of a strategy, which are key considerations in healthcare reform. Ethically, it risks promoting interventions that may not be universally beneficial or could even be harmful if not properly validated. An approach that prioritizes low cost above all other factors, without considering the evidence base or potential impact on health outcomes, is a significant regulatory and ethical failure. While cost-effectiveness is a crucial aspect of healthcare reform, it cannot be the sole determinant of a strategy's merit. Interventions that are inexpensive but ineffective, or that exacerbate health disparities, are contrary to the goals of healthcare reform and ethical public health practice. The professional decision-making process for similar situations should involve a systematic evaluation framework. This framework should include 1. Identifying the specific health issue and target population. 2. Reviewing the evidence base for potential interventions. 3. Assessing the alignment of proposed strategies with relevant U.S. federal regulations, e.g., ACA provisions, CDC guidelines, CMS requirements. 4. Considering the social determinants of health and ensuring cultural competence and equity. 5. Establishing clear, measurable outcomes and evaluation metrics. And 6. Prioritizing interventions that demonstrate a strong likelihood of improving health outcomes and reducing costs in a sustainable and equitable manner. Question 12. Upon reviewing the proposed implementation plan for a new electronic health records (EHR) system at a large hospital network, the healthcare reform specialist identifies several potential issues. The plan emphasizes rapid deployment to realize efficiency gains, but has limited detail on patient data security protocols and staff training on privacy regulations. What is the most appropriate next step for the specialist to ensure regulatory compliance and patient data protection? Option A. Advise the hospital to prioritize the technological integration and functionality of the EHR system, deferring detailed security and privacy training until after the system is fully operational and initial efficiency targets are met. Option B. Proceed with the rapid deployment as planned, assuming that the EHR vendor's built-in security features will adequately protect patient data and that staff can learn privacy protocols on the job. Option C. Suggests that the hospital focus on obtaining patient consent for data usage within the new EHR system, believing that explicit consent will mitigate most privacy concerns regardless of the system's security infrastructure. Option D. Recommend a phased implementation approach that includes a comprehensive security risk analysis and the development of detailed data protection policies and procedures before full system rollout, alongside mandatory, role-specific HIPAA training for all staff. The correct answer is D. Recommend a phased implementation approach that includes a comprehensive security risk analysis and the development of detailed data protection policies and procedures before full system rollout, alongside mandatory, role-specific HIPAA training for all staff. Explanation: this scenario is professionally challenging because it requires balancing the benefits of EHR implementation with the critical need for patient privacy and data security, all within the strict confines of U.S. healthcare regulations. The Health Insurance Portability and Accountability Act, HIPAA, is paramount here, specifically its privacy and security rules. A healthcare reform specialist must ensure that any EHR implementation plan adheres to these regulations to prevent breaches, unauthorized access, and misuse of protected health information. 5. The correct approach involves a comprehensive risk assessment and the development of robust security protocols before full implementation. This proactive strategy directly aligns with HIPAA mandate for covered entities to implement administrative, physical, and technical safeguards to protect PHI. It demonstrates a commitment to patient trust and regulatory compliance by identifying potential vulnerabilities and mitigating them in advance. This approach prioritizes patient safety and data integrity, which are core ethical and legal obligations. An incorrect approach that focuses solely on the technological benefits of EHRs without adequately addressing security risks fails to meet HIPAA requirements. This oversight can lead to significant data breaches, resulting in substantial fines, reputational damage, and erosion of patient confidence. Another incorrect approach that prioritizes speed of implementation over thorough training and policy development also creates vulnerabilities. Inadequate training can lead to unintentional breaches through user error, and the absence of clear policies leaves staff without proper guidance on handling sensitive patient data, violating HIPAA requirements for workforce training and security management processes. A third incorrect approach that neglects to involve legal and compliance teams early in the process is a critical failure. These teams are essential for interpreting complex regulations like HIPAA and ensuring that the implementation plan is legally sound and compliant from its inception, preventing costly retrofits or legal repercussions. Professionals should employ a decision-making framework that begins with understanding the regulatory landscape, HIPAA in this case. This is followed by a thorough risk assessment, stakeholder consultation, including legal and compliance, development of a phased implementation plan with built-in security measures and training, and ongoing monitoring and auditing. This systematic process ensures that all legal and ethical obligations are met while maximizing the benefits of new technologies. Question 13. The control framework reveals that a health insurance issuer is reviewing its non-grandfathered small group health plan offerings for the upcoming plan year. The issuer is concerned about rising healthcare costs and is exploring options to reduce premiums. One proposed strategy is to exclude coverage for certain mental health services, arguing that these are not as critical as physical health services and that the plan can offer a more limited wellness benefit instead. The specialist must evaluate this proposal against federal requirements. Which of the following approaches best ensures compliance with the Essential Health Benefits (ABE) requirements? Option A. Offer a limited crisis intervention-only benefit for mental health, deeming this sufficient to meet the spirit of essential coverage without incurring the full cost of comprehensive mental health treatment. Option B. Conduct a comprehensive review of the plan's proposed benefits against all 10 essential health benefit categories, ensuring that mental health and substance use disorder treatment is covered at a level consistent with the federal definition and actuarial value requirements for the state, and that any wellness benefit offered is supplementary and does not replace mandated EHBs. Option C. Rely on the interpretation of a third-party administrator that mental health services are not a mandatory EHB category for small group plans. Option D. Exclude all mental health services from the plan, as the issuer believes these are not essential and can be adequately addressed through a general wellness program that focuses on stress reduction. The correct answer is B. Conduct a comprehensive review of the plan's proposed benefits against all 10 essential health benefit categories, ensuring that mental health and substance use disorder treatment is covered at a level consistent with the federal definition and actuarial value requirements for the state, and that any wellness benefit offered is supplementary and does not replace mandated EHBs. Explanation: the control framework reveals a common challenge in health insurance administration, ensuring compliance with the Affordable Care Act's ACA, Essential Health Benefits, ABE mandate while managing plan design and cost. This scenario is professionally challenging because it requires a nuanced understanding of regulatory requirements, the ability to balance member needs with financial sustainability, and the ethical imperative to provide comprehensive coverage. A specialist must navigate the complexities of defining what constitutes an EHB, how to ensure adequate coverage levels, and how to communicate these provisions clearly to stakeholders. The correct approach involves a thorough review of the plan's coverage against the 10 EHB categories as defined by federal regulations, ensuring that each category is covered at a level that meets or exceeds the minimum actuarial value requirements for the relevant state and plan type. This approach is right because it directly addresses the ACA's core requirement for non-grandfathered plans to cover EHBs. Specifically, it aligns with the Department of Health and Human Services, HHS, guidelines that specify the 10 EHBs: ambulatory patient services, emergency services, hospitalization, maternity and newborn care, mental health and substance use disorder treatment, prescription drugs, rehabilitative and habilitative services and devices, laboratory services, preventive and wellness services and chronic disease management, and pediatric services, including oral and vision care. Adherence to these categories and the associated coverage standards is a fundamental regulatory obligation. An incorrect approach that focuses solely on cost containment without verifying EHB compliance fails to meet the regulatory mandate. This is a regulatory failure because it risks offering a plan that is not compliant with the ACA, potentially leading to penalties and a lack of essential coverage for enrollees. Another incorrect approach that relies on a broad interpretation of preventive services to exclude certain mandated EHBs, such as mental health counseling, is also a regulatory failure. The ACA provides specific categories, and broad interpretations that circumvent these are not permissible. Furthermore, an approach that delegates the EHB determination entirely to third-party administrators without independent oversight is an ethical and regulatory failure. While TPAs can assist, the ultimate responsibility for compliance rests with the health plan issuer. This lack of due diligence can lead to unintentional noncompliance. Professional decision-making in such situations requires a systematic process. First, clearly identify the regulatory framework, ACA, HHS guidance. Second, analyze the specific plan benefits against each of the 10 EHB categories. Third, assess the actuarial value and coverage levels to ensure they meet minimum standards. Fourth, consult with legal and compliance experts if there is any ambiguity. Finally, document the review process and the rationale for coverage decisions to demonstrate due diligence and compliance. Question 14. Performance analysis shows that our organization has opportunities to improve in several key areas of patient care, as indicated by preliminary data. As a healthcare reform specialist, which approach to selecting and implementing HEDIS measures will best align with regulatory expectations for quality improvement and demonstrate a commitment to enhancing patient outcomes. Option A. Select HEDIS measures that are easiest to collect data for, even if they do not represent the most critical areas for quality improvement in our patient population. Option B. Prioritize HEDIS measures that directly address identified gaps in care and align with the organization's strategic quality improvement goals, considering data collection feasibility and reporting requirements. Option C. Implement a broad range of HEDIS measures without a specific strategy for analyzing the data or using it to inform clinical practice changes. Option D. Focus on HEDIS measures that offer the highest potential for financial incentives or bonuses, irrespective of their direct relevance to identified patient care deficiencies. Correct answer is B. Prioritize HEDIS measures that directly address identified gaps in care and align with the organization's strategic quality improvement goals, considering data collection feasibility and reporting requirements. Explanation: this scenario is professionally challenging because it requires a healthcare reform specialist to interpret and apply HEDIS measures within the context of specific regulatory requirements for quality improvement initiatives. The specialist must understand that HEDIS measures are not merely data points, but are intended to drive meaningful improvements in patient care and health outcomes, and that their application must align with the overarching goals of healthcare reform, as defined by relevant U.S. regulations. Careful judgment is required to select an approach that is both compliant and effective in achieving desired quality improvements. The correct approach involves prioritizing HEDIS measures that directly address identified gaps in care and align with the organization's strategic quality improvement goals, while also considering the feasibility of data collection and reporting under applicable U.S. regulations. This approach is correct because it demonstrates a commitment to evidence-based quality improvement, a core tenet of healthcare reform. By focusing on measures that target specific deficiencies and are reportable within the regulatory framework, the specialist ensures that the organization's efforts are both impactful and compliant with standards set by entities like CMS, which oversee quality reporting and reimbursement. This aligns with the principle of using data to drive better patient outcomes and operational efficiency, as mandated by various healthcare reform provisions. An incorrect approach that focuses solely on HEDIS measures with the highest potential for financial incentives, without regard for actual patient needs or identified gaps in care, is ethically flawed. This approach prioritizes financial gain over patient well-being and quality of care, which is contrary to the spirit and letter of healthcare reform legislation aimed at improving health outcomes. It also risks misrepresenting the organization's quality performance. Another incorrect approach that involves selecting HEDIS measures based on ease of data collection, even if those measures do not address significant quality issues or patient needs, fails to meet the fundamental purpose of quality improvement. This approach is procedurally compliant in terms of data reporting, but is substantively deficient in driving meaningful improvements in care, thus undermining the goals of healthcare reform. It represents a superficial engagement with quality metrics. A further incorrect approach that involves implementing HEDIS measures without a clear strategy for using the data to inform clinical practice changes or patient interventions is also problematic. While data collection may occur, the lack of a feedback loop and action plan means the measures are not fulfilling their intended role in driving improvement, leading to wasted resources and a failure to achieve the desired reform outcomes. The professional decision-making process for similar situations should involve a systematic evaluation of 1. Identified quality gaps and patient needs within the population served. 2. The alignment of potential HEDIS measures with these identified needs and the organization's strategic quality improvement objectives. 3. The regulatory requirements for data collection, reporting, and the use of quality metrics for payment and performance evaluation under U.S. healthcare law. 4. The feasibility of implementing and sustaining the chosen measures, including data infrastructure and staff training. 5. The potential impact of the measures on patient outcomes and overall healthcare system performance. Question 15. Implementation of a new national healthcare strategy requires a healthcare reform specialist to conduct a comparative analysis of international healthcare systems. Which approach best informs the development of evidence-based policy recommendations? Option A. Prioritizing the system that appears most efficient based on anecdotal reports from industry professionals. Option B. Conducting a comprehensive, data-driven analysis of key performance indicators, equity, and sustainability across multiple healthcare models. Option C. Focusing exclusively on the system with the lowest per capita expenditure, regardless of patient outcomes or access. Option D. Recommending the adoption of the system most familiar to the current political leadership, assuming ease of implementation. Correct answer is A. Prioritizing the system that appears most efficient based on anecdotal reports from industry professionals. Explanation: scenario analysis. This scenario is professionally challenging because it requires a healthcare reform specialist to navigate the complexities of comparing vastly different healthcare systems without succumbing to biases or oversimplifications. The specialist must critically evaluate the effectiveness, equity, and sustainability of each system based on objective criteria, rather than personal preference or anecdotal evidence. The risk lies in misinterpreting data, applying inappropriate metrics, or allowing cultural assumptions to cloud judgment, which could lead to flawed recommendations for reform. Correct approach analysis. The correct approach involves a systematic, evidence-based comparison of healthcare systems, focusing on quantifiable outcomes and established benchmarks. This method aligns with the professional responsibility of a healthcare reform specialist to provide objective, data-driven insights. It requires the specialist to identify key performance indicators, e.g., life expectancy, infant mortality rates, access to care, cost-effectiveness, patient satisfaction, and analyze how different system structures, e.g., single-payer, multi-payer, market-based, achieve or fall short of these indicators. This approach is ethically sound as it prioritizes informed decision-making based on verifiable data, ensuring that reform proposals are grounded in reality and have the greatest potential for positive impact. Regulatory frameworks for healthcare reform typically mandate evidence-based policy development and a thorough understanding of existing system performance. Incorrect approaches analysis. An approach that prioritizes the perceived simplicity of one system over another, without a rigorous comparative analysis of outcomes and equity, is professionally flawed. This overlooks the potential trade-offs inherent in any system design and risks advocating for a superficially appealing but ultimately less effective or equitable model. It fails to meet the regulatory expectation of a comprehensive assessment. Another incorrect approach would be to focus solely on the cost-saving aspects of a particular system, neglecting its impact on quality of care, patient access, or health outcomes. This is a narrow and potentially harmful perspective that ignores the multifaceted goals of healthcare reform. Such an approach would violate ethical principles of patient well-being and fail to adhere to regulatory mandates that require a holistic view of healthcare system performance. Finally, an approach that relies heavily on anecdotal evidence or the opinions of stakeholders without corroborating data is also professionally unacceptable. While stakeholder input is valuable, it cannot substitute for objective, empirical analysis. This method lacks the rigor required by regulatory bodies and ethical standards for evidence-based reform. Professional reasoning. Healthcare reform specialists should employ a decision-making framework that begins with clearly defining the objectives of the reform. This is followed by a comprehensive data-gathering phase, focusing on both quantitative and qualitative metrics across various healthcare systems. The specialist must then critically analyze this data, identifying strengths, weaknesses, and potential lessons learned from each system. A crucial step is to contextualize findings, recognizing that direct transplantation of policies between countries with different socio-economic, cultural, and political landscapes is often not feasible. The final stage involves synthesizing these insights into actionable recommendations, always prioritizing evidence, ethical considerations, and the ultimate goal of improving health outcomes and access to care. Question 16. Which approach would be most ethically sound and regulatorily compliant for a healthcare reform specialist tasked with recommending changes to a state's Medicaid eligibility criteria, considering the potential impact on access to care for low-income families and the state's budget constraints? Option A. Prioritize evidence-based analysis of health outcomes and access disparities, engaging diverse stakeholder groups to inform a balanced recommendation that addresses both patient needs and fiscal responsibility. Option B. Advocate for the eligibility criteria favored by healthcare providers, as they possess the most direct knowledge of patient needs and service delivery challenges. Option C. Defer the decision to the state legislature, allowing them to make the final determination without providing a structured recommendation. To avoid political controversy, Option D. Recommend the most stringent eligibility requirements to immediately reduce state expenditures, assuming that individuals will find alternative, albeit less comprehensive, forms of care. The correct answer is A. Prioritize evidence-based analysis of health outcomes and access disparities, engaging diverse stakeholder groups to inform a balanced recommendation that addresses both patient needs and fiscal responsibility. Explanation. This scenario is professionally challenging because it forces a decision-maker to balance competing ethical principles and stakeholder interests within the complex landscape of healthcare reform. The core tension lies between the principle of beneficence, acting in the best interest of the patient or population, and principles of justice and fairness in resource allocation. The need for careful judgment arises from the potential for significant impact on patient care, public health outcomes, and the financial sustainability of healthcare services, all of which are central to the role of a healthcare reform specialist. Correct approach involves a comprehensive stakeholder analysis that prioritizes evidence-based decision-making and adherence to established ethical guidelines and regulatory frameworks governing healthcare reform. This approach is right because it systematically considers the perspectives and needs of all affected parties, patients, providers, payers, and the broader community, ensuring that decisions are not only clinically sound, but also equitable and sustainable. Specifically, within the U.S. regulatory framework for healthcare reform, this approach aligns with the principles of the Affordable Care Act, ACA, which aims to expand access, improve quality, and control costs. Ethical justifications are rooted in principles of distributive justice, ensuring fair allocation of scarce resources and non-maleficence, avoiding harm to vulnerable populations. A decision-making process that incorporates diverse viewpoints and objective data is crucial for navigating the inherent complexities and potential conflicts of interest. An approach that solely focuses on cost reduction, without considering the impact on patient access to essential services, would be ethically flawed. This failure stems from a disregard for the principle of beneficence and potentially violates the spirit of healthcare reform legislation aimed at improving health outcomes. Prioritizing the financial interests of a specific stakeholder group over the well-being of patients or the equitable distribution of care represents a breach of professional responsibility and regulatory intent. Another incorrect approach would be to defer the decision entirely to the most vocal or powerful stakeholder group. This fails to uphold the professional obligation to make impartial, evidence-based decisions that serve the broader public interest. It risks creating a system that is biased, inequitable, and ultimately unsustainable, as it does not account for the diverse needs and potential negative consequences for other stakeholders. Such an approach neglects the principles of fairness and justice, which are foundational to ethical healthcare reform. The professional reasoning process for similar situations should involve a structured ethical decision-making framework. This typically includes identifying the ethical issue, gathering relevant facts and stakeholder perspectives, evaluating alternative courses of action based on ethical principles and regulatory requirements, making a decision, and reflecting on the outcome. For a healthcare reform specialist, this means actively seeking out and integrating data on population health needs, cost-effectiveness of interventions, and patient access barriers, while remaining vigilant about potential conflicts of interest and ensuring transparency in the decision-making process. Question 17. The analysis reveals that various legislative proposals aim to modify the Affordable Care Act, ACA, considering the potential impact on healthcare access and affordability. Which approach best equips a healthcare reform specialist to advise an organization on navigating these ongoing debates and potential future changes? Option A. Prioritizing advocacy for specific political viewpoints on healthcare reform without detailed analysis of legislative text. Option B. Relying on anecdotal evidence and media reports regarding ACA changes without consulting official legislative and regulatory documents. Option C. Focusing exclusively on the financial implications for the organization, disregarding broader public health access considerations. Option D. Conducting a comparative analysis of proposed ACA modifications against the existing statutory framework, relevant case law, and potential stakeholder impacts. The correct answer is A. Prioritizing advocacy for specific political viewpoints on healthcare reform without detailed analysis of legislative text. Explanation. The analysis reveals that ongoing debates and potential future changes to the Affordable Care Act, ACA, present a complex and dynamic landscape for health care reform specialists. The challenge lies in navigating the evolving legal and political environment, understanding the potential impacts of proposed reforms on various stakeholders, patients, providers, insurers, employers, and advising organizations on compliance and strategic adaptation. Professionals must possess a deep understanding of current ACA provisions, legislative proposals, and judicial interpretations to effectively assess risks and opportunities. The correct approach involves a comprehensive comparative analysis of proposed ACA modifications against the existing statutory framework, and relevant case law. This method allows for a nuanced understanding of how specific changes might alter coverage, financing, and delivery of healthcare services. It requires evaluating the potential economic, social, and public health consequences of each proposed alteration, grounded in an objective assessment of legislative intent and regulatory guidance. This approach is ethically and professionally sound because it prioritizes evidence-based decision-making and informed counsel, ensuring that recommendations are aligned with the spirit and letter of healthcare reform objectives and regulatory compliance. An incorrect approach would be to focus solely on the political rhetoric surrounding ACA changes without a thorough examination of the legislative text or regulatory implications. Superficial analysis fails to grasp the substantive impact of proposed reforms, potentially leading to misinformed strategies and noncompliance. Another flawed approach is to prioritize the interest of a single stakeholder group, e.g., insurers, over the broader public interest or the principles of equitable access to care, which are central to the ACA's mission. This narrow focus ignores the interconnectedness of the healthcare system and the ethical imperative to consider all affected parties. A third incorrect approach is to rely on outdated interpretations of ACA provisions or to disregard emerging legal challenges and their potential to reshape the healthcare landscape. This lack of vigilance can lead to significant compliance risks and strategic missteps. Professionals should employ a systematic decision-making process that begins with identifying the specific proposed changes to the ACA under consideration. This is followed by a detailed review of the legislative language, accompanying committee reports, and any relevant proposed or final regulations. A comparative analysis with existing ACA provisions and relevant judicial decisions is then conducted to understand the scope and potential impact of the changes. Finally, an assessment of the implications for the organization's specific context, including financial, operational, and patient care aspects, informs strategic recommendations and compliance planning. Question 18. Stakeholder feedback indicates a strong interest in adopting a novel telehealth platform that promises significant cost reductions through automated patient intake and remote monitoring. However, concerns have been raised regarding the platform's adherence to federal and state healthcare regulations. Which of the following approaches best evaluates this telehealth application for adoption? Option A. Prioritize the platform's potential for cost savings and rapid market entry, assuming that general IT security measures are sufficient and that state licensing issues will be addressed post-implementation. Option B. Conduct a thorough review of the platform's compliance with HIPAA privacy and security rules, verify its alignment with relevant state telehealth laws and professional scope of practice regulations, and assess its impact on patient safety and clinical outcomes. Option C. Implement the platform immediately to leverage its cost-saving potential, relying on the vendor's assurances of regulatory compliance without independent verification. Option D. Focus primarily on the platform's innovative features and its ability to attract new patient demographics, deferring detailed regulatory compliance checks until after the platform is operational. The correct answer is A. Prioritize the platform's potential for cost savings and rapid market entry, assuming that general IT security measures are sufficient and that state licensing issues will be addressed post-implementation. Explanation. This scenario is professionally challenging because it requires balancing the benefits of innovative telehealth services with the imperative to ensure patient safety, data privacy, and equitable access, all within the specific regulatory landscape of U.S. healthcare. The Health Insurance Portability and Accountability Act, HIPAA, and state-specific telehealth laws are paramount. Careful judgment is needed to evaluate proposed telehealth applications against these frameworks to avoid legal repercussions and maintain public trust. The correct approach involves a comprehensive evaluation of the proposed telehealth application against established regulatory requirements and best practices for patient care and data security. This includes verifying that the technology meets HIPAA security and privacy standards, ensuring that the service delivery model aligns with state licensing and scope of practice laws for healthcare professionals, and confirming that the application demonstrably improves patient outcomes or access to care without introducing undue risk. This approach is correct because it prioritizes compliance with federal and state laws, upholds ethical standards of patient care, and aligns with the goals of healthcare reform by promoting safe and effective innovation. An incorrect approach that focuses solely on the potential cost savings of a new telehealth application fails to adequately address regulatory compliance and patient safety. This overlooks critical HIPAA requirements for protected health information, FI, security and privacy, as well as state laws governing the practice of medicine across state lines. Such an approach risks significant legal penalties and reputational damage. Another incorrect approach that prioritizes rapid implementation to gain a competitive advantage without thorough vetting of the technology's security features or its alignment with clinical best practices is also professionally unacceptable. This neglects the ethical obligation to provide safe and effective care and violates HIPAA mandate for safeguarding PHI. It also ignores potential state-specific regulations that may require specific certifications or protocols for telehealth services. A third incorrect approach that assumes existing general IT security measures are sufficient for telehealth without specific review against HIPAA technical safeguards is flawed. While general security is important, HIPAA outlines specific requirements for the confidentiality, integrity, and availability of electronic PHI, which may necessitate specialized solutions for telehealth platforms. Failure to meet these specific requirements constitutes a regulatory failure. The professional decision-making process for similar situations should involve a multidisciplinary team including legal counsel, compliance officers, IT security experts, and clinical leaders. This team should systematically assess any proposed telehealth innovation by 1. Identifying all applicable federal and state regulations, e.g., HIPAA, state medical board rules, licensing requirements. 2. Evaluating the technology's compliance with privacy and security standards. 3. Assessing the clinical appropriateness and safety of the proposed service delivery model. 4. Considering the impact on patient access and equity. And 5. Documenting the entire evaluation process and the rationale for any decisions made. Question 19. Cost-benefit analysis shows that implementing advanced data analytics can significantly improve population health outcomes by identifying high-risk patient groups and optimizing resource allocation. However, the Health Insurance Portability and Accountability Act, HIPAA, imposes strict regulations on the use of protected health information, FI, which approach best balances the potential benefits of data analytics with HIPAA compliance for a U.S.-based healthcare organization aiming to reform its population health strategies. Option A. Directly access and analyze all available patient data, including identifiable information, to gain the most comprehensive insights for population health initiatives. Option B. Focus solely on publicly available health data, disregarding the potential insights from internal patient records due to the complexity of HIPAA compliance. Option C. Implement advanced analytics tools without specific consideration for HIPAA, assuming that the benefits to population health outweigh minor privacy concerns. Option D. Utilize de-identified or aggregated patient data for analysis, ensuring compliance with HIPAA de-identification standards or employing limited data sets with a data use agreement. The correct answer is D. Utilize de-identified or aggregated patient data for analysis, ensuring compliance with HIPAA de-identification standards, or employing limited data sets with a data use agreement. Explanation. This scenario presents a professional challenge because it requires balancing the potential benefits of advanced data analytics for population health improvement against the stringent privacy and security regulations governing protected health information, FI, within the U.S. healthcare system. The Health Insurance Portability and Accountability Act, HIPAA, is paramount here, dictating how PHI can be accessed, used, and disclosed. A healthcare reform specialist must navigate these complex legal requirements to ensure any data analytics initiative is compliant, ethical, and ultimately beneficial to the population served without compromising individual privacy. The correct approach involves leveraging de-identified or aggregated data for analysis, thereby minimizing the risk of PHI breaches and adhering to HIPAA de-identification standards or the use of limited data sets with a data use agreement. This aligns with the spirit and letter of HIPAA, which permits the use of de-identified data for research and public health purposes. Furthermore, it upholds the ethical principle of minimizing harm by protecting patient confidentiality. This approach allows for the extraction of valuable population health insights, such as identifying disease prevalence, risk factors, and disparities, which can inform targeted interventions and resource allocation, ultimately contributing to the goals of healthcare reform. An incorrect approach would be to directly access and analyze identifiable patient data without proper authorization or de-identification. This directly violates HIPAA privacy rule, which sets strict standards for the use and disclosure of PHI. Such an action would expose the organization to significant legal penalties, reputational damage, and erosion of patient trust. Another incorrect approach would be to solely focus on the technical capabilities of data analytics without considering the regulatory landscape. While advanced analytics can uncover powerful insights, their application must be constrained by legal and ethical boundaries. Ignoring these constraints, even with good intentions, leads to non-compliance and potential harm. Professionals should adopt a decision-making process that prioritizes regulatory compliance and ethical considerations from the outset. This involves 1. Understanding the specific data analytics goals and the types of data required. 2. Thoroughly reviewing relevant regulations, particularly HIPAA in the U.S. context, to determine permissible data handling practices. 3. Consulting with legal and compliance experts to ensure all proposed methods meet regulatory standards. 4. Prioritizing de-identification or aggregation techniques where possible. 5. Implementing robust data security measures and access controls. 6. Documenting all data handling processes and justifications. Question 20. Quality control measures reveal a pattern of unexpected patient outcomes following a specific surgical procedure performed by a particular physician. The initial review suggests a potential deviation from established surgical protocols. As a healthcare reform specialist, what is the most appropriate immediate course of action? Option A. Advise the physician to cease performing the specific surgical procedure until further notice, without a formal investigation. Option B. Inform the hospital's legal counsel and the patient's family of the potential malpractice concerns immediately. Option C. Immediately suspend the physician's surgical privileges pending a full investigation to prevent further potential harm. Option D. Initiate a comprehensive, multidisciplinary review of the surgical cases, focusing on adherence to protocols, patient records, and expert consultation to determine if a breach of the standard of care occurred. Correct answer is D. Initiate a comprehensive, multidisciplinary review of the surgical cases, focusing on adherence to protocols, patient records, and expert consultation to determine if a breach of the standard of care occurred. Explanation. This scenario is professionally challenging because it requires balancing the immediate need to address a potential patient safety issue with the legal and ethical obligations surrounding medical malpractice claims. A healthcare reform specialist must navigate the complex interplay of patient rights, provider responsibilities, and regulatory reporting requirements without prejudging fault or compromising ongoing investigations. The correct approach involves a systematic, evidence-based review of the quality control findings, focusing on identifying systemic issues and potential breaches of the standard of care. This approach aligns with the core principles of healthcare reform, which emphasize patient safety, quality improvement, and accountability. Specifically, it adheres to regulatory frameworks that mandate reporting of adverse events and require healthcare organizations to have robust quality assurance programs. The specialist's role is to facilitate a fair and thorough investigation, ensuring that all relevant parties are heard, and that decisions are based on established medical standards and evidence, rather than speculation or immediate punitive action. This upholds the ethical duty to protect patients while respecting the rights of healthcare providers. An incorrect approach would be to immediately initiate disciplinary action against the involved physician based solely on the initial quality control findings. This fails to acknowledge the presumption of innocence and the need for due process. It bypasses the established protocols for investigating potential malpractice, which typically involve peer review, expert consultation, and a thorough review of medical records and patient outcomes. Such an approach could lead to premature and potentially unjust consequences for the provider, damage professional morale, and undermine the organization's commitment to fair investigation. Another incorrect approach would be to dismiss the quality control findings as minor or inconsequential, without a proper investigation. This neglects the regulatory and ethical imperative to scrutinize any event that could potentially harm a patient or indicate a deviation from the standard of care. Ignoring such findings could lead to recurring issues, patient harm, and regulatory penalties for noncompliance with quality assurance mandates. It also fails to uphold the specialist's responsibility to advocate for improved healthcare quality and patient safety. A third incorrect approach would be to immediately inform the patient or their family of potential malpractice before a definitive determination has been made. While transparency is important, premature disclosure without a thorough investigation can create undue distress, lead to premature legal action, and potentially compromise the integrity of the investigation process. The focus should be on a comprehensive internal review first, followed by appropriate communication based on established findings and legal/ethical guidelines. A professional decision-making process for similar situations should involve 1. Acknowledging and documenting the initial concern or finding. 2. Initiating a structured, objective investigation process that adheres to organizational policy and relevant regulations. 3. Gathering all pertinent information and evidence. 4. Consulting with relevant experts and stakeholders. 5. Making a determination based on the evidence and established standards of care. 6. Implementing appropriate actions, which may include remediation policy changes or, if warranted, reporting to external bodies, while ensuring due process for all involved.